will just allow people to understand that this is a healing forum. And the knowledge that comes from us as a community in this circle, the knowledge and experience comes from this yarn is going to help heal our community. And we want to make sure we focus on that strength of healing. So if anyone has questions or they want contributions, reflect on how can we look toward focusing on our issues in the community and putting that light of healing toward it. So as we start the panel, I'll pass the mic and everybody's going to introduce themselves. These are important people in our community, and you are also important in this circle. So we'll have this yarn together as a conversation as a community. So I'll just pass the mic on, and I'll pass it to you first, Sheree.
Hi everybody, my name's Sherry Collis. I'm the Deputy CEO of GWAS, so the AMS here at Mount Druitt. I'm a Wiradjuri woman from Wellington, born and raised in Willow. I never left Wellington until October last year when I came down to work at Mount Druitt. Absolutely love it down here at Mount Druitt. We've got an awesome team down there at the clinic, and really looking forward to moving forward in the future.
My name's Paul Morris. I'm a Dungatti Wanneroo man. I'm the Executive Manager for community programs out here. So I've got a connection out here in Western Sydney. My kids were born and raised out here at Shelby, so it's good to be working out here in the local community, and yeah, looking forward to getting out and engaging with everyone.
Hello, my name is Coralie Wales. I work for WentWest, which is the primary health network. I lead WentWest's Community Partnerships program, which is a new program, been going for 11 months. My job is to bring community relationships into partnerships through personal relationships, acknowledging everybody's big picture goal, which is the well-being of Western Sydney people, but also accommodating each other's goals along the way. So your goals, what's important to you, that's important to us, and we work hard at accommodating that. My colleague Lauren is here today, and like many of WentWest's people, she's a young, early stage woman who is learning like we all are all the time. Thanks for inviting me.
Hi, Andrew Melito is my name. I'm a doctor at Kildare Medical and work with the team there. I was raised at Durrock Mount Druitt, and John is my brother, which I'm proud to say. He's doing a great job. Yeah, so it's really good that we can actually now, when we were younger, our lives were separated. I was overseas a lot, but now we can actually work together, which is great. So, yeah, thank you.
Hi everyone, my name's Louise Moore, Aboriginal health practitioner, team leader at Kildare Medical Service, and I'm a Githable woman from Northern New South Wales. Thank you.
Hi, hi everyone. My name is Sonia Cameron. I'm from Wiradjuri, Narandra. I'm the project officer at Western Sydney Integrated Care. I'm also a registered nurse and a diabetes educator.
Oh, hi everyone. I'm Penny Abbott. So I came to know this community when I was working at the AMS, so at Durrock and then AMS Western Sydney. So I was there for 25 years, and now I'm working in the prison system. Well, I've been doing that for a long time too, as a visiting GP at Emu Plains and Dilwynnia in the female prisons. I've got a real interest in, you know, health and wellbeing of Aboriginal and Torres Strait Islander people and justice-involved people. I'm also at Western Sydney Uni, so I'm teach there and I do some research there.
So the first question, as a panel, we want to pose to you guys from your lens, from your eyes, from your vision and experience, from your heart and your mind. What do you see as some of the important health issues in our community and what you do in your role?
Start with me. I think for me personally, but as an AMS, one of the biggest health issues that we see with our people is obviously mental health issues. Particularly over this COVID pandemic in the last couple of years, we've seen a rise in mental health patients that visit the clinic. So as a service, what we can do to support that, all AMSs and community controlled health services have linked with them the social and emotional wellbeing team. So part of our team, we have 6 staff in that team that Paul looks after now, and they do some great community work. I know as a service, the AMS may not have a great history here at Mount Druitt, but we've got a great team moving forward, and it's definitely something that we want to improve with the service. We want to look at more community engagement. We want to, our vision is that we want to have more community involvement, and that, the services that we provide actually come back to the people and what we need in this community, and that to me, that's really important to me as a deputy CEO down here, and creating a vision for the service down here that suits this community, and that's something that we're workshopping now. Not if people aren't aware, we actually have taken a new road and a new path with the organisation where we will have our own autonomy down here. So we will be looking at, building those partnerships in the community and how we can better service the community. Did you want to add?
Yeah, just to add a bit more, drug and alcohol is also a major issue. Our Mums and Bubs programs, we're on top of a lot of things, how we're going with our ANFPP program and our Connected Beginnings, but there's always room for improvement. There's a lot more than just talking about health issues. There's a lot of things around it that we need to discuss too, like just upskilling our local community and bringing in people that are going to add to our service and improve outcomes. Like it's one thing to have the service and have it going and have KPIs to address, but we need to have a look at our outcomes and how healthy our communities are getting. So, yeah, they're just a few things.
Thanks, Paul. I'm hearing that there are problems on the ground. There's, drug and alcohol problems. There are diabetes problems. There's all sorts of problems. But what I am really connected to is that if we were to get in early and prevent some of the problems that arise, and the way we would do that is partly why I'm at Went West, because the leadership at Went West is really devoted to dealing with those upstream factors, like how do you make sure that children have a good life in the first 5 years? How do you make sure that children at age 15, instead of looking down the barrel of incarceration, they're looking down the barrel of which university will I go to and how will I contribute to my community? So I think that idea of prevention and getting upstream is what is the great opportunity here in Western Sydney. Certainly Went West stands behind that as a model, and unfortunately the current systems do not fund that kind of approach. So we really do need to look at as advocates, we need to be looking at the upstream system transformation that will enable us to really prevent the problems that we see.
Thank you. Yeah, I agree with the AMS from Mount Druitt that mental health is by far, in my exposure at Kildare, it's a major problem. And the reason why it's a major problem is because I don't think that there's enough government support with psychiatrists and their input. And it's not only, Kildare's tried to establish pathways with justice and corrective services so that those who are going in or coming out of a jail aren't falling between the gaps. They're actually picked up and there's a solid pathway that they can follow, and it can be facilitated. So, for example, with Sonia, the work that they're doing is fabulous, because when they come to us, then they can follow them up, and they do everything they can to establish, mental health practitioners as well as doctors to come on deck. Another area too that I'm concerned with, and at this stage we're not really sure how to manage it, and that's the paediatric area where, the abuse of young Aboriginal children, and trying to get them to seek help, but quick. It always seems too late and too late, and very difficult to get doctors to actually diagnose them, so then we can commence with the proper treatment. But I'm very hopeful, because there's some great teams, we've established within the Kildare and with Sonia's team, and I'm very hopeful. And I think these pathways will become very strong, and they will aid the community in their well-being.
I've got to totally agree with the panel on what they're saying about mental health. It has escalated since COVID come in, and as we know, so many of our young people have passed away from suicide. And not only that, chronic disease in general, diabetes, heart disease, we've lost so many community members. And the reason why I love my job is because I love working with GPs to break down the barriers to, try and get, our life expectancy of our people. Too many of them are dying young. And, if I can make a difference, that's what I'm passionate about, and working with the community, and hopefully, we can work together to break down these barriers.
Wow, hard to follow up. So just a little, our organisation, we work with people with chronic care conditions, and we can help with financial aids and other things. But one of the things since doing this job is helping Aboriginal people navigate this health system. It's actually, for even health professionals, it's quite mysterious, and it's quite confusing. So empowering Aboriginal people to navigate and to say what is out there for me and how do I access it. And also, when we get we get funding for all sorts of different organisations, and a lot of times Aboriginal people in the community don't know they're out there. And the funding will be there for 12 months, and then the funding will go. So you're trying to work out, do we have that funding here? Do we have that funding there? And having a central place, or even empowering our Aboriginal health workers, our nurses and our doctors, educating them what is out there for our people. Because we do get this money and it gets into little pockets. And then only... how do we all know what's there and what's not there? And I think that's one of the things that I've learnt, that you're constantly trying to work out for our people as nurses, as Aboriginal health workers, what's out there for our people, how do we tap into it? And having something central, and information central, and if you do get out and I've been in that position where I've had young mothers and people, especially with suicide, and they're worried about their kids, where I'm running around saying, where do we go? It's not easy. And then the poor parents, if I'm, as a registered nurse, I've worked at the Aboriginal Medical Service for over 25 years, I'm a diabetes educator, and now I'm a project officer at an integrated care program. If I'm on the computer and racking my head around how to get help for this 13-year-old that has a suicide attempt, how do parents do it? So I think we really need to come together as a community and get together and work out for these parents and for these people with chronic care conditions, empower them on how they get help.
Yes. Look, I think there's been sort of... I agree with everything, and that's really, I guess what I just maybe add in, just a couple of things from my background. So firstly, I just think we're talking about the health of the whole community, and I think it's good to just remember like what a great community it is actually. All my career I've just felt, I think, probably more drawn to this community than any other, just because of the joy in it and the connections and the respect everyone has. And so there's a lot of strengths, and building on those strengths, like in events like we're doing today, I think is very important. The other thing that I just add in, I think it's really important, and it can be community led and supported, to build the skills of doctors and other healthcare providers to actually really be able to provide a good service. I think that's one of the things I'm very interested in my university role, and just professional roles, I suppose, just how hard it can be to find, say, a GP who actually does know what's around and who perhaps has understanding of how to promote cultural safety and stuff for people, and also to practice like trauma-informed care, like assist in a way that helps patients, and just to be a better workforce. So I think that's another very important part of what we need to do.
Thank you for your contributions. And I've been listening very deeply to what you've been saying. And I just want to unpack something that you might not be aware of, but in what Baabayn is doing with its healing work, we wanted you guys to be here because we don't just want to create kinship and support networks in our communities by empowering individuals that support their families. We want to decolonise and break down, because we talk about what's culturally appropriate service. And as you mentioned, when you're trying to navigate a system that even professionals can't understand, how do you make it culturally appropriate for community members? How does it work when community mobs are fighting over limited funding? So we talk about these institutions and decolonise, but we don't want to decolonise. We want to indigenize, and this is what Baabayn is doing. So when we invited all you mob here, we invited you for the purpose of creating kinship amongst organisations in our community, because the system puts us against each other, because everybody's fighting for limited funding, and we've got organisations that have similar roles, and the system puts us against each other with that divide and conquer. And that is the history of Australia, of division and conquer. And we want, as Aboriginal community, as sovereign community, and the voices in our community, we want people to work together in kinship and connection to help us heal ourselves. And that's why we want also for you guys to build relationships amongst organisations, to see opportunities, and the report and video that comes out of this, we want it to be something that helps build those relationships. So there's a strong vision, a connected, shared vision where organisations can work together. And not in opposition, but in solidarity as members of community, because you are also members of our community. So for us to empower and build capacity in individuals, firstly, we need to empower and understand the issues that we're facing as far as systems. We want to indigenize those systems to create kinship. We don't, as I said, like yesterday, we don't want a new room in the prison that's got a window. We want to step outside that prison and say, hey, we don't want the system to accommodate us in what we do. We're going to step outside that prison, and the system needs to meet us equally on equal terms and negotiate those partnerships and outcomes as equals. That's empowerment. And we want to empower you. We support you. We want you to work with each other. In doing that, in saying that, I'd like to open it now for this part of the panel to some questions from our community here, from this circle. Share a question or ask a question or share your perspective. Rachel.
Part of the problem, though, is the system. The system doesn't work for us. The Aboriginal Medical Centre does not have enough doctors. You're waiting for a month to get an appointment. When you're sick, you want to see a doctor straight away. So then, because you can't get an appointment there, you might go to Kildare Road. Then you go to Kildare Road and you're waiting long times because there's so many people going there. You're waiting to see a doctor, and you don't want to do that because you're sick. The funding system. I've been a sufferer of mental health for a long time. The ladies at Baabayn know what I've been through. I had a major breakdown 8 years ago, and every 6 months I was in hospital, and the hospitals were the worst place for me. Like that, I came out worse, The good thing now is I'm a member of the assertive team at Blacktown Mental Health, and I have a great doctor. I've had him for 2 years. I've been out of hospital now for 2 years, and I've felt, I've stuck with my medication because I know that that's good for me, and that's part of the problem is like me being an Aboriginal person, I don't want to always rely on medication. I want to go back to my roots and, and do traditional medications and things like that. Like my grandmother used to, put in my head, if you're sick, you go to this or whatever. But like I said, the system really needs to change for us as people, and then we're going to be able to empower ourselves and, and not have to use your services. You know what I mean? Move aside and let the younger generation who need it.
Yeah, thank you, my sister. And that vision of what you're sharing is, that vision and the aspiration of having more doctors, having more Indigenous doctors, having them support our AMS and and being in places like Kildare and having that presence. That's, again, we need to put these targets up there. How do we support our services? How do we support the AMS? How do we support private clinics to have Indigenous doctors? How do we work together as a community to meet those targets and those aspirations we come from our community? Anyone else take a safe risk, ask a question? Up the back here.
I've been a sufferer of mental health for probably 25 years, and I'm one of the ones that was stolen. And I've always had a bit of a problem with going to the Aboriginal Medical Centre, and as the girl said before, it's a matter of actually waiting for doctors, and sometimes I'll come back next week and then you have. I get tired of actually kind of relying on medication. It's like when you spring a leak, they just plug you up with another tablet. And I've also been in psych wards, and I agree, they're not the places, and now I've found that I'd rather go all the way into Redfern, where now that I've found that I'm getting appropriate treatment, and I've gone back into not conventional medicine. I've actually found a Chinese herbalist who now treats me with acupuncture and herbal tea. But yeah, the problem is that finding the appropriate treatment and also the waiting time, and sometimes you get brushed off, and I've had real issues with that. So so thanks.
Thank you for that. Oh, Julie, yeah. And it's really deadly to hear people's voices in our community. This is what it's all about.
Hi everyone, I'm Julie, Coordinator for Jurara Indigenous Education. We have a lot of families that come through our system that are desperate for help to get into a paediatrician, to get psychologists. We've tried Growing Early Minds. We're desperate, and we're just a very small cog in a system where we've got people crying out to say we need our little ones helped, and there's only so much that we can do, but we need to find ways so our families can get in to see a psychologist, a psychiatrist, a GP, OTs, speech. And it's so frustrating, and it's, I'm not playing a blame game here by any means, but it's the system has to change so that there aren't these barriers, because we know if we address it early enough, we've got amazing young men and women that go on to become the leaders in our society. But we can't support our families enough to get the help that they need at that critical point. So, paediatricians are a big one that keep coming up, because we need assessments done before we can have diagnosis, before we can have funding for supports in schools. And it breaks our heart, because there's not enough of us on the ground and there's not enough of you. So we need to get that message out there to say, come out and actually listen. Don't speak, don't try and fix us, don't try and save us, but listen to what our community and our families need.
In regards to the paediatricians, that was one of the first barriers that I came across, especially for if you're trying to get NDIS funding and then you need these assessments, and they can be $3,000 and $4,000. So one of the first things I did was speak to the LHD, and they mentioned that they do have paediatricians at Mount Druitt, and that they will prioritise Aboriginal children. There hasn't been much after that, and I think maybe we need to start coming together and maybe pushing that a little bit, because that's right in the middle, that's bang right in the middle. It's in Mount Druitt Hospital, and maybe we need to start really building on that, because that's come up multiple times, where OT, speech, paediatricians for these assessments that can sometimes go up to $5,000. Where does a family get that money from? And as an IT, and this is one of the things that we could be helping the funding, but from a team coming from where I sit, that our funding would, if we paid for everybody, our funding wouldn't last very long. So where is this in mainstream? Where in mainstream do we go? And we need somewhere in mainstream, a whole team of paediatricians. Mount Druitt Hospital would be perfect, where we could get our kids in and get all these services that they need, and they can all interlink. You know, it makes it difficult even from the services. If you get an OT from Parramatta, you send the clients to a private one in Parramatta, and then you go and see a speech therapist in Penrith. How do they link? Then you've got the problem of them not linking with us. So you have to have a service that is together, that they talk to one another, and it's a one-stop shop for Aboriginal families. So yes, I do agree with that very much.
Yeah, we need more partnerships, like with, the hospitals. And, can I just ask, is the paediatrician still, Dr. Ho, still going to the AMS? Yeah, and
he gets overwhelmed.
yeah, that's right.
Yeah.
Yeah, and that's so. And, when you do, Andrew can, the doctor's always referring patients to go to a paediatrician, psychiatrist, whatever, but the waiting list is enormous to get them in. By that time, it's, 12, maybe even 12 months, so the waiting list is terrible. So we need more partnerships with the hospitals, and like, that partnership with Dr. O, where we used to, the patients would come to the AMS, or, he'd set a spot up the hospital for our patients when they were referred up. Like with Dr. Carota, with the ENT, he used to have a spot up the hospital just for the AMS patients when they presented up there. So, we weren't waiting. So that's what we need, more partnerships with the LHD. And
for my daughter-in-law to see a paediatrician that's at Rudy Hill, but she charges, and it's quite a lot of money. And at first she was having to go half and half, and it's just money that we can't afford. And even within the schools, we were asked to go back and get an IQ test. And one of the teachers said her son waited 6 years to get that IQ test because the counsellors within the school, they're not available. Like, they're there one day a fortnight, and they've got that many kids that they have to see. They just don't get around to it.
There's a couple of eligibility if someone has a chronic condition, but one of the things that we could have helped is paying for those, maybe the counsellor or anything else. But my argument was, when I came onto this program, that's lovely and that's something that we can do, that's fabulous. But what happens if our program stops tomorrow? We are back to where we started. We need to get these things in mainstream, because funding comes and goes. It's lovely to have this, but we need that. Like you said, we need it in Mount Druitt Hospital. That's the perfect place for it, where you'd set up all these things and they're bulk billable. And then you're looking at that. So
and we go backwards, and all of us end up, with mental health or whatever. This is my problem. I've got 5 kids, 13 grandchildren.
Yeah.
And it's just ridiculous.
I agree with you. That's what I'm talking about, him getting into that system. That's where we need to, I think, since COVID, we were in the chronic care team at the AMS many years ago, before Closing the Gap came in. And I noticed in those days, that was before Closing the Gap money came in, that we had so many specialists that used to come to the AMS and that bulk billed. When I walked into this program, I couldn't believe what we were getting charged. We were getting charged the amounts of money. I was saying, what is going on? This is Closing the Gap. We need to come together. We can't be. So it was all these specialists that were bulk billing previously, seeing this bucket of money And then we're charging on, what were they calling it? Private health money.
For all the stuff that went on with the AMS and the changeover and everything, and this is not putting anything on you guys,
No.
because you guys are just trying to help where you can, we did have a one-stop shop. You know, we knew we could go there and have, like, I had a great a psychiatrist. He was fantastic.
Yes.
You've seen the paediatricians. The kids could get their medications or whatever. You didn't have to go searching for other paediatricians wherever you could find them. You know, everything was there. And now, you know, you guys are trying to build it up, but it's just such a slow process.
But I think it still has limitations.
But also, too, now we have COVID babies. I've got new grandchildren that have been born during COVID. They don't know how to relate to society because they've been stuck indoors. You know, we've had lockdowns and whatever. These kids are like this new batch of kids that don't know anything, you know.
And I'm going to keep it there. There is limitations with, and it's nothing to do with the AMS, there is limitations with a one-stop shop in an AMS, and I'm a great believer in AMSs, but the problem is not everyone goes to an AMS. There's lots of these little pockets of doctors that Aboriginal people need support with. So that's why I was saying it has to be, you've got to have something in mainstream that people, no matter where they go, have access to it.
So I just wanted to add on to what you guys were saying, just in regards to the paediatricians at Mount Druitt Hospital. We obviously have Dr. Ho that comes once a month to the Mount Druitt Clinic, but his waiting list is quite extensive. So we have also had the same discussions with the LHD about the Mount Druitt Paediatrician Clinic, which is, you know, we're going to have ongoing discussions with them about that. At the end of the day, we just want to make sure we have great referral pathways for patients that come into the clinic, particularly those that are on the waiting list. And also just to talk about just to mention about the doctors. I know that the doctors obviously are a big issue across the board. That's nationwide. It's not just Mount Druitt specific. Getting a GP anywhere at the moment is a very hard job to do, but we have managed to get 2 part-time doctors. So we're hoping that may assist with our waiting list. I know it doesn't help right now, but, you know, so we've got 2 part-time, 2 days a week. So we have another doctor potentially 4 days a week.
We'll go to Louise, and then Arnie Elaine had a question.
I was just going to say, you know, I noticed that difference from going from the AMS to private practice like Kildare Road Medical Service, where you got all these specialists in-house and, you know, then we have to refer out to other specialists where we wait in months where, you know, the system with the AMS having the specialists in-house, it really was fantastic for our mob and, you know, it did. That's what we need, more of that to break down the barriers and with our kids and whatnot.
Yeah, well, you nearly made me forget my question now, but anyway. No, look, I really agree with everything yous are all saying. But being a part of this community, a part of the health service itself, being working in health, being a grandmother, rearing up grandchildren that I had to take on, and I'm pretty sure everyone, the 4 grandchildren that I'm rearing up, have all got a need to see a mental health worker, as a paediatrician, a psychologist, whoever can help me. You know, I've been trying to get my children, my 4 grandchildren, in for specialist care. The oldest is 17 in a couple of weeks. The youngest is 13. I've been battling. The youngest 2, 13 and 14-year-old, I've had since they were born. The other 2 were 1 and 2. So I've had these children a long time. I've been battling all them years. All those years to try and get them good mental health care. And I understand, I know where yous are all coming from, and I know, but, you know, there's got to be a better way. You know, can you wait a minute? Sorry, but you know, I've got the mic now, and I'm a community person, and, you know, and I don't want to lose this mic because it'll run all over the room without me. And, but where was up to now? You're making me up. But, yeah. I know, I don't mean to be rude or anything, but I just get a bit carried away sometimes. I'm a bit radical too. But yeah, with my grandchildren, yeah, look, I just struggle with the you know, and what do they call themselves now? Justice, health, or something? The facts, docs, or welfare, or whatever they are. They change their name every year, I think, every financial year maybe. Yeah, I've been dealing, with them, and they put my grandchildren in out-of-home care. You know, they think that's going to solve the problem, but my grandchildren still had all these problems, and I didn't want to do it. I just didn't want to do it, but while my grandchildren were waiting for care, they became teenagers and got out of control. And I couldn't rein them back in for the life of me. I could not rein these kids back. And there was nowhere for me to go with them, you know, nowhere. When COVID hit, oh, yeah, we can counsel them over the phone. My kids leg up on you. Yeah, it's all right. We can get a counselling session over the phone, but as soon as you ask them the wrong question, they'll press, the red button. And, and I had 3 grandchildren kicked out of the one school. Who does that, the one family? 3 granddaughters put out of the school, because they've been through all this trauma and this stress and this anxiety, and I'm battling to get them help and sending them to school, and they're walking out of classrooms and jumping fences. Oh, they're chasing them. Look, he's got no idea the stress of it all, and the health department has got no idea of it too. And I just wanted to say how hard it is to get our children good care out there, and like I said, my oldest granddaughter, she's 17 in 2 weeks. 12 months, she's old enough to go to jail, and that's where she's heading. And I don't want that. I don't want that for her or any of the other grandkids. But you can see, I had to call what them people name Justice Health or whatever back in to our lives. And they turned around and told me that, but they're in your care now. We can't interfere. And I said, well, you bloody well better, because my kids are off the rails. I can't, there's no help out there for them. So, and I'm just one story, and there's heaps of these stories out there that you probably don't hear, but I'm one of these people that talk, and I talk, and I do things about things. I'm sorry, John, I know I'm hogging the mic, and we said we'd never do that, but, this is my hour to shine. And, and I want everyone to know how hard it is out there for us all. And and I know yous are all doing a good job, believe me. I know, I've been there, and I've done it all, but so I just want to, we need more paediatricians, more child psychiatrists and psychologists, and we need more help out there for our kids, because our kids are, at the moment, with these phones and iPads and everything they live for, it's not helping. It's not helping the whole situation of their trauma. It just traumatises them more, I think. And, so that's just me say, and I'm going to shut up now.
Thank you. And listening to these stories is what's really important, because we understand that from COVID and the system in regards to the mainstream is already under stress. But we've got to not look at the negative, look at the strength. Our people have survived. We are resilient. We are strong. We are deadly. And hearing our stories gives us a vision of what we need to help our community. And the vision we want to actually connect through kinship and that relationship, all the systems and all the organisations that help our community. And we don't want government policy. We want community policy to speak, and you guys are a part of that.
Yeah, and I just wanted to thank Elaine and Rachel and everyone for sharing what's going on. It's so important as health people and as managers and stuff to just hear it from the people what's going on. I mean, it's just, you know, there are not many medical students choosing general practice, for example, nowadays. You know, it's really dropped by half. There's lots of problems in the system we need to work towards. I just wanted to say that I think the community partnering with the PHN, the Primary Health Network, provides sort of some opportunities because they've got all these connections in with the local health districts. Like there's a program called Keys, for example, which is specifically trying to support families of children under the age of 5 and, you know, like care navigation type stuff so that people can find the service they need. So, and also the Primary Health Network has responsibility for choosing what services are going to be the right services so they can I just think the more engagement with the Aboriginal community, the better. Like we've got a consumer council, but we've actually, you know, haven't had that much, I think, Aboriginal representation on that council yet. And like, I think, I mean, I'll pass to Coralie because this is one of Coralie's jobs is to sort of fix this. But I just think there's lots of ways forward there. That's some avenue that people should try and harness.
I wanted to thank Baabayn aunties because you are the people who brought this together. And I find my role, I mean, I'm the luckiest person in the world because I get the opportunity to listen and to learn. I've been in Western Sydney for 8 years and I've made many friends. And to your point, Penny, Cassandra Ebsworth is on our Consumer Council, but Cassandra's got many different hats and very, very busy. We've just invited another First Nations friend and colleague onto that the Consumer Council. But look, it's open to anybody who wants to have conversations with Went West. Went West has a primary responsibility, a mandate to identify what is needed. And so, for example, there are a number of programs for people to walk into if they need mental health support. They don't have to wait. They're in Western Sydney. Head to Health is one. I think it's really important to acknowledge the care coordination that's going on too, because one of the primary things we heard in the last lot of listening was this need for peer workers, because people that are living with a problem and then become an integral part of the program.
I thought it was a joke because, you know, they were nice young people. They were nice young people. Just when the kids were starting to get used to these people coming into to our home, and you know what, one lovely young man come in and said, "Oh, I can come in and kick the ball around with the kids, and or we can, I can spend time and with them in the afternoon." And I thought, oh yeah, okay, I'll give anything a try. Yeah, I'll do that. And this young woman used to come in and sit and talk, but they're only there for as soon as we all started getting to know these people, they come in and say, "Oh, look, I won't be back after today because my time's up." Well, what do you mean your time's up? Yeah, my kids still need this support, and they still need, yeah, well, sorry, our hands are tied. You know, do you know how deflating that is for someone my age? For people to come in and help and then just say, "We can't help you anymore. We got to go because we're only allowed in your home and help you and the kids for 6 weeks," or whatever it is, and then kids just start getting used to these people and trusting them, and things and then they're gone. You know, it's very traumatising. It just blows you away. I don't know what's going on in this country, I'll tell you. I really, really don't know. When they can just neglect our children. And, yeah, I know it's just not Aboriginal children, but, yeah, they just leave you flat. Yeah, I'm 73 years old and I'm still rearing up grandkids that I'm getting no help with, by the way. And that's why I go to Baabayn and lay it all out, you know. And, you know, it's just so important for... And I know you can't do much with the funding or anything, but maybe if you know what's really going on out there in the community, you know, it might be a help to everybody, you know, like... My granddaughter she won't even go and get a job because she suffers with all this anxiety. Because she thinks people are judging her and looking at her, you know. And I can't get them in to see psychologists or anybody. You know, it's just too much.
There seems to be, from a health perspective, from an education perspective, from a child protection perspective, there needs to be conversations that happen where we break down the silos, talk about, do an environmental scan, not only just of Western Sydney or Mount Druitt, but do it in all the areas where you've got district offices or where you've got health services, and make the services real so that people are getting the continued support. And then, like in Aunt's case, like you've shared with me how you felt like the department abandoned you, abandoned the parents, and abandoned the kids when they removed the kids from their parents. Like, this is lifelong stuff and it's generational stuff. So I'm thinking, like, as a suggestion, because we want to go from trauma to healing, from trauma to resilience. And part of that is, let's be smart and be brave with how we do the planning, do the funding, because, like, when I was listening to Rachel talk and yourselves responding, I'm sorry, but these are Band-Aid solutions. And it's just plugging a hole where one seems to spring up. Like, let's focus on some, one or two particular things. And if it's about kids in the education system who are demonstrating that they've got some learning needs, then let's work with education and all your specialists. If you've got kids that have got mental health and aren't accessing the education system, then work together. Or if you've got kids that have been removed and they're dealing with a lot of the trauma there, then get child protection and health systems working together. But drill it down so it's like an environmental scan that is relevant to Mount Druitt, relevant to Blacktown. Instead of, like, I'm sorry, I know you guys are doing a fantastic job and you're picking up something that was broken, but a doctor once a month is not going to cut it. Like, let's be real about it. And you've heard here this morning, and we've got to hear yesterday, but then we get to hear every other day and every other week because people live it. We get to hear what the issues are, what the trauma is, but we want to move past the trauma and we want to do something proactive. We want to demonstrate. We want to indigenise the systems because we're never going to change them. So let's indigenise them to make them relevant to our people.
What do we see that we want to aspire to? What are the things that we need for our community to bring that healing? Some of those things I've heard is integrating systems where to help organisations and services work together in a better way, to provide holistic, big picture services that are not just for one generation but are intergenerational. So what I'll do is I'll ask you guys, what is the vision for healing in the community? You know, as we've heard, like, AMS needs more support. What is the vision? What do we aspire to?
I think for us, and we've already touched on it a lot this morning, is just hearing the community voice, hearing what the community needs are, and trying to work out how we can support that to happen. The other thing is obviously building better partnerships within the Mount Druitt community and working together to address those needs.
Yeah, and just to add to that, like, just true engagement with people, with groups, with organisations, government departments and everyone around the way. So that we've all touched on it earlier. There's a big need for a lot of things to happen around here, and to address these a lot of these issues that have been raised, it's going to take a long time. It's going to take a lot of money. So that real and meaningful engagement will go a long way.
I think Went West is very aligned with what came out of your paper in 2018, which was the Baabayn Healing Forum paper. And that vision that I heard when I reviewed that paper deeply was that you wanted trauma-informed care, you wanted care that was connected, you wanted peer-led care where it was appropriate, you wanted the primary health network to be supportive. Now, Penny's touched on one problem that we have and that we've got to address, and we can't do it alone. We can only do it with the community, and that is, how do we inspire people to become health workers? How do we inspire young students to become doctors and nurses? Because if you talk to doctors, you will hear that they are breaking. They are breaking. You know, there are not enough doctors to go around. And a young doctor will say, I don't want to be a general practitioner, it's too hard. There's no work-life balance. They're broken. If not broken, they're breaking. So I think there's a bigger picture here that we have to be aware of, and we have to together address that with the unified voice that I hear is your aspiration from reading that paper. That came across loud and clear. One voice, a unified voice to speak up for the needs of people. In particular, at that time it was Mount Druitt, but we can broaden it to Western Sydney if you like. But it's certainly a unified voice that is led by the community. So how do you do that? That has to be a decision that is taken with partners, and we all share our resources so that we can, I guess the Went West dream is that care is connected, that you don't have siloed funding between education and health. That dream is somewhat of a reality. We've done that now with, I think 300 families have gone through a particular program that Penny mentioned. And the outcomes are extraordinary because there is no silo. Everybody shares the same pool of money. And they've demonstrated it, it works. So Went West's dream is that is how health will work. That is the future vision. We've demonstrated it's possible. We're trying to get the word around that program exists. It's a sister program to the integrated care program, but it's aiming at any family that's got a child that's 0 to 5. Anybody in that family could need support. It might be that the teenager needs particular help. It might be that the father needs particular help, or the mother. Whatever that help is, this program works with that family's goals to make that a reality. Now that is working. And I have to say that a large proportion of those families are First Nations families. So, Went West's dream is to challenge the government, and he's already doing that in primary care. There is, at the moment, you might have heard on the news, the primary health network momentum that is building for system transformation. It means that the medical benefits scheme has to be challenged. You can't pay people for minutes. You've got to pay people for outcomes. And that's going on now. We can all be part of that. There's nothing stopping any one person in this room for being an advocate for that sort of change. And it's when with one voice that government hears loud enough. If it's loud enough and articulate enough and respectful enough, governments don't want to be embarrassed. They want to move with communities. Communities are voters. There is a great potential. Sorry for talking so much, but it's a huge opportunity.
Yeah, look, I actually feel like I've been hit in the chest. It's so, sometimes when you hear these personal stories, it's just so overwhelming. And you think, where do we start? So I just try to think myself on a practical level, where can I start as a doctor? I can encourage people, to become GPs and so forth. But on a practical level, a friend of mine a long time ago said, like, for an arrow to hit its target, all the flights have to be in the same direction. And I think for us to hit our target, we've got to really unite, and extend out hands of friendship to each other, regardless of what's happened in the past. Because one thing that upsets me so much, it's about the community. It's not about the organisations and the money. It's about us. So for myself, I'd like to even, I don't know, this is just an idea. Obviously within a clinic you've got teams set up, and we've got one where all our doctors say, right, who knows this or who can put me in contact with that? wouldn't it be good if we had a community one where every allied health, doctors, clinics, we could just throw out something in there so people will have another connection or a network, regardless of if we're going to take away patients or they're going to get more funding, but just keep focused on the target, which is the people within the community. The other thing is with my issue is with the bulk billing issues with psychiatrists and paediatricians. I think the community should target psychiatrists and as a community approach them and say, reach out for their heart. You know, let them know, invite them to play, things like this and just continually hound them, so you can penetrate into their hearts and find the compassion within them, because it lies there, because that's their profession. But it gets jaded over the years as they go through. And, for them to give their time to the community. So as a community, we should, target specialists and then continually contact them and offer them and let us be in their mind continuously throughout the year, so they'll find that compassion and then give their time and give their time to heal us. So I think that's what I'd like to see. I'd like to see some type of network where we can just throw things out there so other community members can see and help.
For me personally, I get what you're saying, Rachel, and me working in a mainstream service, we've been trying to work together with Andrew and the owners to make it a system where our mob comes in, where they're identified at reception so that myself or Hannah is notified, and then we can, get a GP on board that's not going to let our mob wait so long to see a GP. And I'm going to say this, I'm sorry I'm going to have to say this, but we need to leave black politics aside when it comes to the health of our people. Because you've got people in identified positions that are not culturally appropriate. Thank you.
I just agree with it, and I really agree that we've got to come together. It's all right to talk about partnerships, but as I said, and I absolutely agree, we're silos. And having Aboriginal care coordinators educated on what's out there is absolutely essential. And I must admit, and one of the other things I've heard is, I've heard a lot of people saying we're trying to employ Aboriginal health workers, but it's been 1 to 2 to 3 to 4 months. Let me tell you, we employed 8 Aboriginal health workers within a month in our organisation. So don't tell me it's hard to get Aboriginal health people in there. You've got to be looking out and letting people know and letting these young, brilliant Aboriginal young people out there know that these jobs are there for you, that we can help train you. You're going to love it. You're going to be working for your people. So, and that's another thing I think that we need to build on.
So look, I think that was very important, and I guess I just wanted to add in that I do, totally agree that we need big system change and stuff, and we want to avoid sort of band-aids that are going to fall off. But I think we also just need to recognise how important the little things can be, and that even small changes, like I think of myself like as a cog in a wheel, sort of moving towards sort of a better future, I guess. And I just was thinking about a patient, a woman in prison I saw a couple of weeks ago, and she was planning for a release. She had young children. There was all kinds of stuff going on with her, and we were just talking about how things were going to go for her. And she just mentioned that she'd had this good relationship with a nurse in the prison who'd made her feel that she could do it, and she was just sort of saying, well, she knows a lot of stuff, and if she thinks I can do it, then I feel like maybe I can. And I just sort of thought that just shows the influence of just almost like one consultation with a patient that's done in a correct way and that's positive, that can really help people. So I feel like we should also not get too disheartened as we keep on with the work we're doing, and just remember that you can make small changes that do make big changes for people.
Thank you all for that. And I think we have one last question, and then we'll we'll move on because time's getting on. We've got to switch out panels.
Sorry, I don't know if it's... I hope I get a question out of it, because I have been listening to what you've been saying, and I suppose it's a bit of a response and hopefully a question. I did hear that, you know, we need to be empowered, and I did hear about the lack of services. I did hear about trying to keep politics out of it, and I do totally get the lack of mental health support and about our children. And I did hear about COVID. So in terms of COVID, until COVID occurred, I didn't rest. I've never stopped, just like these women here. You don't stop. And until the universe flipped, I'd realised that I'd never had a rest. Yes, I've had a burnout. Yes, I've crashed and burned, but I've never rested. And my body had never rested. And in terms of our looking after our people around us and our families, we've forgotten how to look after our own bodies and our own selves and understand what therapeutic stuff could happen and our natural ability to look after our body and our mind. And I think that's what's missing, because when you have got the ability, you can negotiate with a specialist. It's the GP that is the first point, who generally don't know anything and don't understand closing the gap. I've had many conversations. So if I go to a specialist, I have picked up that phone, and it's very hard to get through I call it the frontline people who look after their specialists, because that's what their job is, to get through to say, I can't afford to wait 9 months to understand why I have DVT. Because I need to understand DVT and know where I got it from, because I didn't have an accident and I didn't have an injury. So why have I got this DVT? Why is the GP happy enough to fill me with medication and send me on my way? Well, I questioned that. So when I finally got through to the woman, and she said the only way you'll get through the specialist is an email. So I wrote her a very firm and assertive email, and I did pull on her. I reminded her about closing the gap, the statistics of chronic disease in Aboriginal people. I gave them my mother's medical history, 44 gone from my world, my father's medical history, the history of my grandmother being refused a hospital bed, therefore died on the Bulgandra mission, giving birth to my father. So while I whinge about not knowing my nan, he didn't even know his mother. So there's a historic thing in our family, and I questioned why I had to wait 9 months to find out, because the treatment was only for 3 months and my DVT, I'm told, would be gone. I got a call directly from that specialist an hour after she read the email. She said, "You give a compelling argument, so I'm going to see you next Tuesday." Now, so I don't need empowering to get something if I need it. And if I didn't do that, would we have ever found the clot in my stomach that was causing the slow bleed to the DVT? Would we? No. I would have had it end up in emergency or something with the bleed that was happening in the stomach. But I was dogmatic to find out what was happening to my body. And we have to do that while we're worrying about everyone else in the family. And while I'll send money up to Dubbo for an MRI for a great nephew, because Mum doesn't have the $500, so I've got to keep working. See, the other issue is the influences that you talk about. So your service providers that want community to have one voice. That's like asking the Liberal government to talk to the Labor government and to the Independents and the Greens. I mean, we have a state where a government body cannot even get their act together to deliver the services that they're paid to do. They're paid to provide to community a health service, a system that we shouldn't have to wait a year or two to see a specialist, yet alone a GP. When you set up a hospital like Mount Druitt, and then you all of a sudden you understand there is no more hospital at Mount. What is there at Mount Druitt? Because until you go and something happens to your family member, you don't know. It's all very quiet and hush-hush. The changes in New South Wales Health have been done with the influences of our creating new cities. So let's put more pressure on. Let's water down the services that are already watered down by creating a population explosion that our GP system, yet alone our teachers and our education and our out-of-home care and our carers, there's an absolute mess going on in this country. And I won't be the one responsible for the big lack of leadership in this country. We have, and we trust, we hope, that Aboriginal people are in identified positions that are there to advise. The sad thing is, it is only advice. So I guess we know what happens with advice. You can take it or leave it. So again, to create advisory committees when we've got people that are supposed to be qualified to be able to sit in a high-ranking position in health, to argue, to put forward their knowledge of what's happening on the ground, to be able to put the services in and how people have access. We should be having direct access to specialists. And in terms of encouraging our young people to take on a medical role, again, I don't know, manipulation, that's how I feel, that unless we, again, have to fix the problem, and now you're actually asking our next generation to fix the problem when it hasn't even been scratched at. And I'm not against it, because my granddaughter is in her final 3 months of her 4-year nursing. Totally wonderful. I'm so happy about that. But that doesn't fix the problem. That will never fix the problem. I'm asking you to think about where you can position yourselves as people to advise and push it up the chain without having to have more work out of us and squeeze the life out of us. I would like it that you take that on. And yes, I'm willing and open, because I've put my name down twice where I've been to health situations where they've said, oh, we'd love to have, you know, the voice of the community come along to these meetings and have a chat. I give my name, my email, my phone number. Did I hear anything back? No. And when I saw and heard all that, I pedal straight back to the young women. You young women, I'm sorry fellas, but I don't mean that men shouldn't do this as well, but when I come across young women, I say to them, you should hear, there's a committee that's going that's interested to talk to you about health. And it should be, oh yes, I was at that event, I put my name down, I put my email down, I put my phone number down. She said, that was 5 months ago, still haven't heard from anyone. So you can't keep asking us as well to be willing and open to give our, you know, guts and garters and not get back to us. And that's not, you know, that's not how it works. You'll only knock at that door a few times. But I just think I'd like you to use your positions and your opportunities to actually have those conversations with people who can make decisions, people in positions of authority, because they are not going to listen to us. Their agenda is not us. We talk about decolonisation, they have de-Aboriginalised every government body in this state. They've taken away Aboriginal positions. Look at Centrelink. Look at the Department of Education. Look at health. So it's the struggle and the mountain for us is just a little bit harder, and we're 2022. Okay.
Yeah, thank you for your voice. And I just want to bring it back because I want to remind everyone it's about us. And I'll give you an example. So I live in Mount Druitt. I grew up in Mount Druitt. My mum was removed at birth. My granny was in Parramatta Girls' Home. Our mum was taken off my granny. They sterilised my grandmother at Crown Street Hospital. So I don't have trust in the health system. We struggled. I grew up with Mob, Cassandra, Auntie Jenny. They seen me here at Edmonton. They seen me growing up in the community. you know, I had the encouragement of elders in our community, and I went on to university and I struggled, but now I've got a PhD. I'm Dr. John Hunter. That's my brother there, Dr. Andrew. I work at Macquarie University. I'm a senior lecturer, academic level C. But you got to understand, I also have intergenerational trauma. My family, my community, I'm a member of that staff, but my family represent the statistics we are all talking about. And people will look to me and say, oh, John, you're in a position of power. Why don't you do this? Well, I can't do it on my own because I'm a member of community, and the same as you, Mob, too. You're all members of community, and I recognise, like my brother, he struggled to become a doctor, as an Aboriginal doctor. We haven't got many Aboriginal doctors. He can tell you for an hour all the struggles he's gone through. So when we talk about we need the problem fixed, let's flip it. You know, it's not about the problem, it's what's happened. What is happening and what do we need to change what's happening through that vision of healing? Because I'm one person on my own. These fellas are all one people on one, you know, I'm an academic, but I'm going to talk black. We're all one peoples on our own, one person, unless we work together and we get the support of community. And, you know, I've burnt out many times. I've wanted to resign many times. But I see deadly young medical students, and some of them are here, and they make me so proud of the way, and they're not even Aboriginal. Make me so proud of how they want to support our community because they see people like me and they hear your voices. And we've got to focus this on healing and remember we got to work together because people like me get burnt out too. Many times I wanted to give up. Many times my brother stopped and he just forgot about it. He said, oh, I'm over it. But he picked up and worked again. How many times as AMS, how many times have our Aboriginal workers in the community burned out? So we've got to do it together. It's not about you fix this, it's about us as a community working together to change this together, taking that sovereignty back.